My name is Dr. Amir. Today's topic is about a very common condition. It is one of the most common reasons patients might seek medical help or miss work. It can affect adults or even school-age children. It is called low back pain. The symptoms of low back pain can be very minimal, like a mild backache, or could be very severe, like a sharp or stabbing pain to a point the patient is not able to move or walk. Sometimes the pain might radiate down to the legs. Most of the time, this condition is very simple. It can improve on its own in few days or by taking over-the-counter pain medications. But if the pain is not improving or getting worse, especially if it's spreading down to the leg with muscle weakness and tingling or numbness in the leg, then it's better to consult your doctor. Let's discover the structures of the spine. This is the whole spine. The lower part is called the lumbar spine. In the lumbar spine, there are 5 vertebrae called L1 to L5. The main function of the lumbar spine is to support the weight of the upper body. There is a space between 2 vertebrae which contain a disc. It acts like a cushion in the spine during our movements. Around the spine, there are muscles, ligaments, and tendons. There are nerves coming out from the spinal cord through both sides of the vertebrae, going down to the legs. So any abnormalities in the above structures can trigger low back pain. So what are the causes of low back pain? The most common one is the sprain in the ligaments or in the muscles, which can cause muscle spasm. Normally it happens after heavy lifting or a sudden wrong movement. Another cause is the presence of a bulging or herniated disc in the spine, which might pinch on a nearby nerve. So if this nerve is the one going down to the back of the leg, then we call this condition sciatica. Also, low back pain can be caused by arthritis in the spine, which can be either from the joints wearing out due to old age or from inflammation like in rheumatoid arthritis. Another cause is osteoporosis, which is thinning of the bone. If this happens in the spine, it might lead to painful fractures and collapsed vertebrae. Also, there is a rare condition, especially in patients with prior history of cancer. If at any time they develop back pain, then we should do MRI to exclude the presence of cancer spread to the spine. For the treatment, we can use pain medications, muscle relaxants, heating pads, and physical therapy. But for the chronic and severe cases, giving epidural cortisone injection might help relieve the pain. And the option for surgery is very rarely needed, unless the condition is very severe and not improving. Prevention is very important to avoid low back pain, and you can achieve this by doing the following. First, regular exercise such as walking or swimming in order to build a strong spine. Second, avoid obesity or being overweight. Also avoid bad posture, especially if you are working behind the desk for a long time. Last but not least, avoid heavy lifting, especially while bending down. And for the children, I advise them not to carry a heavy backpack. My final point, it is common to find a bulging or herniated disc in the spine on a routine MRI. So don't get too concerned about it, and no need to treat it if you're not having back pain. I hope you enjoyed my topic today. If you do, please share it with your friends and subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.